Thank you so much for being here. My name is Martha Mather, and I'm proud to serve as the Chief Administrative Officer for UofL Health Peace Hospital. Today, we celebrate the grand opening of Peace Hospital's Geriatric Inpatient Psychiatry Unit. We recognize the growing need for inpatient geriatric psychiatry services after consulting with geriatricians and long-term care providers in our community, and now we're so excited to be able to offer this vital treatment option to our community. It's located here at Frazier Rehab so that we can ensure a holistic approach to care by meeting both the behavioral health and physical health needs of our patients. With the addition of this unit, Peace Hospital now operates 262 inpatient beds for children and adults. There are so many people to thank today that have been with us every step of the way. I'm so very grateful for that. I would like to offer some special gratitude to Secretary Eric Friedlander for being here today. Thank you, Secretary. I would also like to thank Kevin Young and Tara Ramey, our partners from Signet Health, who are here with us. Thank you. Thank you to Jennifer Stern and Jenny Brown, who have worked tirelessly to ensure this unit was ready by July 1st. And we have already had 3 patients, despite the fact that we're not really open until July 1st. So very proud of that. Thank you. Special gratitude also goes to Jeff Tucker, our project manager, Realm Construction, Ready Electric, Stingle Hill Architects. I know Sydney Gates is here, Steve Humphreys and Doug Amsler, and so many of you who have helped us so much along the way to prepare for this unit. So thank you very much. Now it's my pleasure to introduce Tom Miller, CEO of UofL Health. Tom?
Thank you, Martha. I also want to thank those who were here. Secretary, thank you for coming. We appreciate your help in the healthcare field and all that you've done over the last year in the cabinet to help keep our community safe. So thank you. And also, Mr. Mather here, who is also supporting us. And I also have a couple other people. I want to thank Dr. Vendapudi, who is the board chair for UofL Health, and that's more important than the president of the university from my end. And I want to thank Inspector General Kara Daniels, who is here. They're all a part of making a difference associated with it. So I want to take a second and try to describe what geropsych is, because I have a mother-in-law who has used this, and it's made a difference in her life. And it really helps to address the changes that are brought on by the aging process that can be challenging and overwhelming and sometimes debilitating. Our services seek to offer comfort to seniors suffering from emotional, psychological distress such as depression, anxiety, problems with medications, and Alzheimer's and other types of diagnosis. It is a godsend for these patients who are aging in their process and need a better way to do that, and we offer that. I also want to thank Martha and her team who've done an outstanding job here in helping to put this together. Our goal at UofL Health, and the reason we went this direction, I appreciate Cigna and Joy Fagarski, who is here, who's the president of Cigna, who's helped us, is to really offer to the community a full level of care so they don't have to leave anywhere and they can get it here in Louisville. And this is something that we think is important for UofL Health to make sure that we're meeting the needs of the community. I want to thank all of you for being here and all the staff who are going to take care of these patients. If my mother-in-law's here, thank you in advance for doing that. And let me introduce the president of the university and the chair of UofL Health, Dr. Neely Vendapudi.
Good morning, everyone. I am so glad to see this wonderful turnout because today is truly a special day. It is going to make a huge difference in the lives of patients and their families in this community. I know we've said thank yous, but you have to bear with me. There are a couple of groups that I'm going to call out, and I want everyone to give the most genuine, warm, loud applause you can give. You ready? So first of all, I do want to extend my thank yous on behalf of the university and on behalf of UofL Health to the Secretary, Inspector General, everybody, Mr. Mather for being here. All of you have gone above and beyond to support everything we do. So please, can we have a big round of applause? And of course, you heard Martha and Tom mention our many, many partners who've made it possible for us to be here. So one more round for everybody. And I will save my favorite for the last, which is I want to tell you, you've heard from Tom, the desperate need. Think about anybody who is wrestling with mental health issues, who's wrestling with dementia, and add on to that, that they are your loved ones, older adults. Where would they go? It's my understanding that if it weren't for this, they'd have to leave the county to seek help. And we all know how difficult it is on the whole family when you have to not only provide care, but you have to travel. The huge impact of being able to provide care locally cannot be overestimated. And the biggest thank yous I want you to give are obviously for all of the staff who will be here, the doctors, the nurses, the technicians, but I also want to extend my special thank you to two people who match each other in their tireless energy. And that is Tom Miller, our CEO, who, you know, you tell him something needs to be done, you know that it'll be done. And then the other actually, you don't even have to tell him. You're thinking something, it's done. That's how good he is. And the other person who really matches him in that level of passion is Martha. One of the first places I visited after our acquisition was the Peace Hospital. And to say she inspires me is absolutely the truth. So for Tom and Martha and for all of the people that they represent, please, all of us as a community, let us say thank you for what is truly God's work. You said it's God sent, it truly is. So thank you for making it possible for all of us to make sure our loved ones get great care right here. So for Tom and Martha, let's see. The last thing that I need to do here today is a wonderful duty and honor. I get to introduce somebody who is definitely a friend to the university, but equally important, I was going to say more important, but I should just be diplomatic and say equally important is a friend to me, and that is our Deputy Mayor, Ellen Hassan. Ellen, thank you so much for being here today. Please, the floor is yours.
Thank you, President Vendapudi, Mr. Miller, Ms. Matthews, Secretary Freelander in general. It's really great to be here this afternoon and have the opportunity to speak to all of you. Mayor Fisher is so sorry he couldn't be here, but asked me to come and to send greetings for him and some remarks. So when Mayor Fisher first came to office, he adopted 3 core values to our work: lifelong learning, compassion, and health. Our local health care providers have embodied these values, and the world has watched this fundamental fact over the last 15 months. Thanks to the UofL Health team for your dedication and collaboration as we've been working to stop the spread of the coronavirus. It was inspiring to see so many willing partners step up during this crisis. Your hard work is a big reason we are here today. Your work has saved countless lives, particularly among those older residents who bore the worst outcomes during the virus. And although we still have work to do to get people vaccinated, we've continued to work on other needs in our community. The challenges we face, whether it be the need for greater racial equity or the needs of our aging residents, have not stopped with the pandemic. And in many instances, the pandemic made those needs even more urgent. Our community is thankful to UofL Health and Peace Hospital for seeing the need for inpatient geriatric psychiatric treatment and stepping up to address it. This is a place of safety and hope for people in need of mental health and substance use disorder services. The specific needs of our aging residents are front and center in our community as we are a world leader in addressing lifelong wellness and aging care. So again, thank you to UofL Health and Peace teams for seeing a need and taking action. Patients and their families value your compassion, and our city looks forward to the continued partnership with UofL Health in the years to come. So on behalf of Mayor Fisher, thank you very much.